Have you ever wondered what a urinary tract infection is? Well, it's quite straightforward. A urinary tract infection, or UTI, is an infection that can affect any part of your urinary system. This includes your kidneys, bladder, ureters, and urethra. Think of it like an unwelcome guest that causes a ruckus in your body's plumbing system. Unpleasant, isn't it? But don't worry, knowledge is power. Understanding what causes a UTI can help in its prevention. So let's dive in and learn more. So, what causes a UTI? Well, a urinary tract infection, or UTI, typically occurs when bacteria enter the urinary tract through the urethra and begin to multiply in the bladder. This can lead to an infection because the urinary system is designed to keep out such microscopic invaders. Now you may be wondering, how does bacteria get into the urethra in the first place? There are several common ways. One of the most common is through sexual activity, which can move bacteria from the bowel or vaginal cavity to the urethral opening. Women are particularly at risk because they have a shorter urethra, which means bacteria have a shorter distance to travel to reach the bladder. Another significant risk factor is menopause. You see, during menopause, a decrease in circulating estrogen can cause changes in the urinary tract that make you more vulnerable to infection. In fact, postmenopausal women are often at a higher risk of UTIs. Certain types of birth control can also increase the risk of UTIs. For instance, women who use diaphragms for birth control may be at higher risk, as well as women who use spermicidal agents. So, it's clear that a variety of factors can contribute to the onset of a UTI. But don't worry, being aware of these causes is the first step in prevention. Now that we know the causes, let's explore the symptoms of a UTI. How would you know if you have a UTI? That's a question we often hear, and the answer lies in understanding the symptoms. One of the most common symptoms of a urinary tract infection is a strong, persistent urge to urinate. You might find yourself constantly feeling as if you need to go, even if you've just emptied your bladder. Along with this, you may experience a burning sensation during urination. This can range from a mild discomfort to a severe, sharp pain. It's not something to be ignored, as it's a clear signal that something isn't right. Another symptom to watch out for is passing frequent, small amounts of urine. You may feel the urge to urinate often, but find that very little urine comes out each time. Now let's talk about the appearance of your urine. Urine that appears cloudy is a telltale sign of a UTI. It could also appear red, bright pink, or cola-colored, which could be a sign of blood in the urine. Lastly, you might notice that your urine has a strong, unpleasant smell. While urine doesn't typically have a pleasant aroma, a noticeably foul smell could indicate a urinary tract infection. These symptoms might not all be present at once, and they can vary in severity. But if you notice any of them, it's important not to ignore them. If you notice any of these symptoms, it's important to get a diagnosis. A healthcare professional can help determine if you have a UTI and guide you toward the appropriate treatment. How do doctors diagnose a UTI? Well, let's delve into that. The first step usually involves a urine sample analysis, also known as urinalysis. This is where a sample of your urine is checked for the presence of white blood cells, red blood cells, and bacteria. The presence of these elements can be a strong indicator of a UTI. Now, sometimes a simple urinalysis isn't enough to confidently diagnose a UTI. In such cases, doctors may resort to a urine culture. This is a more detailed diagnostic tool where your urine sample is used to grow bacteria in a lab. This allows doctors to see what type of bacteria are causing the infection, and hence, helps them determine the most effective treatment. But what if you're someone who frequently gets UTIs? Well, in that case, additional tests may be necessary. These could include an ultrasound, a computerized tomography, CT scan, or a magnetic resonance imaging, MRI scan. These imaging tests can show up abnormalities in your urinary tract that may be leading to recurrent infections. In some cases, a cystoscopy might be needed. This involves inserting a thin tube with a lens, a cystoscope, into your urethra and up into your bladder to visually inspect these areas for signs of disease. Understanding the diagnostic process can help demystify what's happening when you're faced with a UTI. Remember, the sooner a UTI is diagnosed, the quicker treatment can start. Once a UTI is diagnosed, treatment can begin. So, how do you treat a UTI? Let's dive into that. The most common way to treat a urinary tract infection, or UTI, is with antibiotics. These medications are designed to kill the bacteria that cause the infection. The type of antibiotic used and the length of treatment depend on the individual's health condition and the type of bacteria found in the urine. Doctors typically prescribe a short course of antibiotics that last from 3 to 7 days for uncomplicated UTIs. For a more severe infection, the treatment may last for several weeks. It's important to take the full course of antibiotics, even if you start to feel better before you finish them. This is to ensure that the bacteria are completely eradicated and to prevent the infection from recurring. In addition to antibiotics, pain relief may also be recommended. Over-the-counter pain relievers can help alleviate the discomfort and pain caused by the UTI.
Pay attention. Remember, while home remedies can help soothe some of these symptoms, it's crucial to consult a healthcare professional if your symptoms are severe or persistent. Recognizing these symptoms early can save you a lot of discomfort and even prevent complications. If you're dealing with a UTI, some simple home remedies could help you find relief. Firstly, one of the most natural remedies you can use is water. Drinking plenty of water helps dilute your urine and ensures that you'll urinate more frequently, allowing bacteria to be flushed from your urinary tract before an infection can begin to take hold. Aim to drink at least 8 glasses of water a day. Another remedy that can be found right in your kitchen is vitamin C. Consuming foods rich in vitamin C or taking vitamin C supplements can help, as this nutrient can inhibit the growth of bacteria in your urinary tract by acidifying your urine. So, you might want to consider adding more citrus fruits and leafy greens to your diet. Now, let's talk about what you should avoid. Certain substances like caffeine and alcohol can irritate your bladder, which might make your UTI symptoms worse. So, while you're on the mend, try to steer clear of coffee, tea, soda, and alcoholic drinks. Heat can also provide a soothing effect. Applying a heating pad over your bladder can help alleviate UTI symptoms like a persistent urge to urinate and lower abdominal pain. Just make sure the heat setting is low and never apply it directly to the skin to avoid burns. Lastly, remember, while these home remedies can certainly help soothe symptoms and may help to clear up a UTI, they should not replace a consultation with a healthcare provider. If your symptoms persist for more than 2 days, or if they worsen, it's important to seek medical attention. With these remedies, you can fight the infection and ease your discomfort right at home. For those who prefer a more natural approach, homeopathic treatments can be a great option. Let's dig into some of these alternatives and see how they can potentially help with urinary tract infections. First up, we have cantharis, a remedy made from Spanish fly, which is known for its powerful effect on the urinary tract. It's often used to treat conditions where the key symptoms are burning pain and a constant urge to urinate. The theory here is that like cures like, a concept at the heart of homeopathy. Next on the list is Staphysagria, derived from the seeds of the Delphinium staphysagria plant. It's used in homeopathy to treat conditions caused by suppressed anger or humiliation, which some believe can be a trigger for UTIs. The idea is to address the emotional triggers to alleviate the physical symptoms. Last but not least, we have sarsaparilla, a plant used in traditional medicine for centuries. In homeopathy, it's often used to treat UTIs where the pain is worst at the end of urination. Sarsaparilla is believed to work by stimulating the body's own healing mechanisms. Each of these treatments aims to stimulate the body's own healing processes, offering a more natural approach to managing UTIs. However, homeopathy is a complex field, and these remedies should be used under the guidance of a professional homeopath or healthcare provider. Homeopathic treatments can be an effective way to manage UTIs, but remember to consult a professional homeopath or a healthcare provider before starting any treatment. So, we've covered a lot about UTIs today, haven't we? We've delved into the surprising facts, understood the symptoms, and explored home remedies and homeopathic treatments. It's vital to remember that these remedies can be helpful, but recognizing symptoms early and seeking medical advice for severe or persistent symptoms is imperative. Home treatments are a good start, but they're not a substitute for professional medical advice. Remember, your health is in your hands. Stay informed, stay healthy, and take care.